When people speak up for themselves, that's called self-advocacy. It is a very important part of the recovery process. A self-advocate has a clear understanding of their needs and rights and how to get those needs and rights met. Self-advocacy can be done in many ways. The National Association of the Deaf, or NAD, lists 7 ways to self-advocate. 1. Request specific accommodations. 2. Know your rights. 3. Educate others. 4. Know whom you are dealing with. 5. Follow proper procedures. 6. Be tactful. And 7. Compromise. Let's look at a common situation where a person may need to self-advocate. Going to the psychiatrist to discuss medication. It is not always comfortable to talk to a doctor. It is an important role for you as a CPSS to teach a peer how to advocate for themselves with their doctor. Many deaf people encounter challenges when managing their medicine, such as communication barriers that often get in the way. Not many psychiatrists know or use ASL. There may be a third party involved, an interpreter, or another person. Or maybe there are no interpreters, or the interpreter is not trained to work with mental health specialty. Discussion between the psychiatrist and the peer is usually limited, and there's not a lot of chance to ask questions or have a discussion. Meeting with a psychiatrist for a medication appointment can make a person feel they have no power. The meetings are short, lasting only 15 to 20 minutes. You're expected to answer a few brief questions, and then the doctor gives you a prescription. And this medicine can be very powerful and impact your life in a negative way. In these meetings, the psychiatrist has a position of power. You are expected to be passive and not ask questions. Depending on the situation, if you follow directions and take your medicine, you may be complimented. But if you challenge, question, or don't follow directions or don't take your medication, you may be punished. Here are some strategies for changing the balance of power during a meeting with a psychiatrist. As a CPSS, you can learn these strategies to help a peer meet with the psychiatrist more successfully. If the peer asks, you can go with them to the appointment, but remember, you cannot take over. You are there to support the peer, to advocate for their needs. Here are things you can help the peer understand. Strategy number 1. Learn to think differently about medicine. Medicine is a tool that supports recovery. Recovery doesn't just happen because a new medicine is prescribed, and medicine is not the same for every person. Each person is different and reacts differently to any medication. Strategy 2, learn to think differently about yourself. You know more about you than anyone else in the room. You can make decisions about your care, identify your goals, and advocate for yourself. The same is true of the peers you support. They are the best person to make decisions for themselves, and other people can't decide for them. Strategy 3, learn to think differently about psychiatrists. Psychiatrists are highly trained experts in treating mental illness. However, the psychiatrist is not living your life. The peer is the expert in how any medication affects them. They know if it's helping them to meet their goals or if they're experiencing side effects that are interfering with their recovery. The next strategy, prepare to meet with your psychiatrist. Before the peer goes to an appointment, they should think about what they want to happen. Is the medication working? Do they need to order a refill of the medication? Is the medication working? Would they like to discuss other options for another medication? Are they feeling physically okay? Emotionally okay? Have there been any major changes in their life? The psychiatrist needs this information to make the appropriate decisions. The peer is responsible to inform the doctor of this important information. The peer should prepare notes so they can be ready to answer questions. They should write their concerns down and show them to the doctor. That way the peer will not forget anything they wanted to discuss. Strategy 5, arrange for communication access. Can the peer communicate effectively with the psychiatrist? Do they need to request an interpreter? Remind them they have the right to communication access. And another strategy, take charge of the meeting. The peer can use their list of questions to guide the appointment. They will need to be assertive, not aggressive, and direct. Remember, the psychiatrist is an important part of the mental health team. If a psychiatrist suggests a new medicine, the peer should ask the following questions. How will I know if it's working for me? How long should it be before I start to notice changes from this medicine? Does this medicine have side effects like headache or blurred vision, nausea? If I should experience a side effect, what should I do about it? If during my trial period with this medicine, I have questions or concerns and I want to check with you, how do I contact you? How long should the trial period of this medication last? And when is my next appointment?